Vocational footballers should be shielded for workout-induced asthmatic, researchers tell, following a research found 3 in 10 could be struck. College of Kent scientists utilized lung tests to identification players in symptoms and superior his suitability following treat. Elitists athletes are named to be inclined to asthmatic-related problems since of his top-intensity respiratory. Expert told screen done feeling and could hinder after problems. In the research, introduced at a meet of the UK breast community, 97 footballers in England of 2 Prime League clubs, 1 League clubhouse and a League One clubhouse had his lung public health proven for before season. 27 players proven favorable for respiratory or respiratory problems, as well named as workout-induced asthmatic. 10 of such had no early story of asthmatic or respiratory problems. While they were purified in relevant medicine, his symptoms, such as leak-proofness of the trunk, rattling and cough following game, diminished, and his lung feature superior above period. The researchers as well found how his aerobic suitability and productivity on the tilt superior. Dr. John Dickinson, of the High School of Kind of Sports and Workout Scientific at the College of Kent, told though top soccer clubs were nice at screen players for cardiac problems, they were not transport out tests that could identification breath problems, that were lot more than overall. Clubs can trust on players' accountability symptoms since they are not ever how evident and occasionally they are spelled off as impoverished suitability, he told. The researchers utilized care tests to evaluate the footballer's respiratory feature and how effectively they could blank his lungs. They were later capable to discover asthmatic-related symptoms exactly and dressmaker treat for such struck. Increasing the public health of footballers' airways as well has some benefits, Dr. Dickinson told. They are less than potential to choose up coughs and colds. Top rates of workout-induced asthmatic include been found in some sport amongst elitists athletes. Expert trust it may be associated to athletes implement routinely at top rate that tool his respiratory rates are as well top while the air is common cold and dried, and if where is exposition to air contamination or some allergens love pollen count, that could deteriorate symptoms, but more than study is necessary to prove the. Dr. Lisa Davies, advisor breath doctor and chairman of the UK Breast Community's Executive Board of Trustees, told lungs were major to workout and lifetime in general in key sport, wherever the lungs are treated difficult and are inclined to reiterate exposition to various and stimulating domestic and foreign facility, it very makes feeling to include lung public health screen, so if where are any respiratory problems they can be purified.